Here is another interesting case. This patient had surgery for a neck swelling in a distant hospital, and after a couple of years, the patient again developed a swelling in the neck. So they referred the patient, and the patient came to us. So we did a CT scan, and we found that there was a huge mediastinal swelling also, communicating with the neck swelling. And this was like displacing the trachea also, and it was a huge intrathoracic, you can see huge swelling in the superior mediastinum. So we thought we'll do approach it through a thoracoscopic surgery, and the neck part that was removed by the neck incision by the ENT surgeon. So we did a team approach, and this is the neck surgery being done. And then rest of the mediastinal part, this was removed through a uniportal VATS. So here is another case where the patient came with chest pain, and they did an angiogram, and the angiogram showed some coronary lesions, and PTCA was done. After some time, patient came back again with chest pain. So the cardiologist did a CT angio, and they found that from this image, you cannot make out, but actually this patient, you can see, if you see closely, something is wrong here. So in the next image I'll show you. So actually this patient had a huge subcarinal bronchogenic cyst. So it was overlapped by the heart shadow. So in a normal X-ray they couldn't see it. Even when they did the cath, then also on fluoro they couldn't make out. But later on we found there's a huge subcarinal bronchogenic cyst, and it is pushing the esophagus towards the left. And also here in the CT you can see how huge cyst is there, and this cyst was lying behind the heart. So it was behind the left atrial appendage. So when we tried to remove by the uniportal technique, the azygos vein, it was just adhering to the upper part, and the inferior pulmonary vein, that was also very much adherent to the lower part. So when we were removing, I'll show you videos. So here you can see you can see the heart pulsation. The cyst was behind this, and here you can see just we could, on retracting the lung and the heart, we can see just a small part of the cyst. You can see the greenish thing. So when we removed the cyst, while we were removing, the azygos vein started bleeding, and it was bleeding into the cyst cavity. So when we were trying to do the hemostasis from above, so it was not possible because it continued to drain into the cavity of the cyst. So the pressures started falling, and then what we did is we ligated the azygos vein, and after that, when we were dissecting the lower part, then the inferior pulmonary vein also started bleeding. So then we did a partial repair of the vein, but we preserved the vein. So then we were able to remove the entire cyst